Thank you for tuning in to my webinar on photobiomodulation and methylene blue. Getting a lot of people who are purchasing the neuro. I want to know, what is this methylene blue and photobiomodulation? What's the deal? So let's make a quick video here. What is methylene blue and how does it work? What conditions does it help? Combination with photobiomodulation, especially the transcranial type. Is it safe? What's an effective dose? And this is the NeuroPro Plus mitochondrial health. This is the one that we recommend. It has vitamin C, and each tablet has 15 milligrams. So 2 tablets has 30 milligrams. You swallow it. You do not chew it. That's why it doesn't make your tongue blue. And you can do meetings and don't look like a Martian. So just to remember, this is some of the scientific literature that comes across from Francesco Gonzalez Lima. And this is just his work, look back 2004 with methylene blue, but he happens to be one of the world leaders in photobiomodulation. So obviously these two will go together, and I'll explain these to you. So why do we use this? Because it's enhanced mental clarity, laser focus, amplify your cognitive functions, pharmaceutical grade, scientifically backed, and it elevates your performance. Again, 1 to 2 pills per day. And what I'm going to point out is that the dosing of this, of when and how we should use this, it's best to use maybe 1 in the morning and 1 at night. And that goes along with the ProNeuro program of why we should take and use anywhere. Do not chew them. And remember this, your urine will turn greenish blue after taking Pro Plus. And that is a way to check your dose. So if you take a pill, when your urine is clear, that means you can take another pill. Very easy, simple. But let's say if we look at the Neurometabolic 2012, the neurometabolic mechanisms for memory enhancement and neuroprotection of methylene blue. Now, I thought that the neurometabolic solution, the name of my book, was a great idea, but this is what they're saying. The paper provides the first review of memory enhancing and neuroprotective metabolism mechanisms of the action of methylene blue in vivo. The mechanisms have important implications as a new neurobiological approach to improve normal memory and treat memory impairment in neurodegenerative associated with mitochondrial dysfunction. Methylene blue's action is unique because its neurobiological effects are not determined by regular drug receptors interaction or drug response paradigms. Methylene blue shows a hormetic dose response with opposite effects at low and high doses. At low doses, methylene blue is an electron cycler and the mitochondrial electron transport chain with unparalleled antioxidant and cell respiration enhancing properties that affect the function of the nervous system in a versatile manner. So what does it mean? As you start to take the pills, you reach your maximum stimulation dose. If you keep taking it, it goes down and it can actually have a negative effect. So 1 to 4 milligrams per kilogram, and it becomes ineffective at 10 milligrams per kilogram. So 1 milligram per kilogram at the lowest dose. If I'm 70 kilograms, that means I can take 70 milligrams of methylene blue. Okay, but I don't think you need that much. Let's just see. The memory enhancing effects have been associated with improvement in memory consolidation in a network-specific and use-dependent fashion. In addition, low-cost methylene blue have also been used for neuroprotection against mitochondrial dysfunction in humans and experimental models of disease. The unique auto-oxidizing property of methylene blue and its pleiotropic effect on the numbers of tissues oxidized explains its potent neuroprotective effect at low doses. The evidence review supports a mechanistic role of low-dose methylene blue as a promising and safe intervention for improving memory and for the treatment of acute and chronic conditions characterized by increased oxidative stress, neurodegeneration, and memory impairment. Methylene blue is an FDA grandfathered and inexpensive drug. It has been used safely in humans for over 120 years. Indeed, methylene blue was the first synthetic chemical used therapeutically in humans. Think about that. Pharmaceutical grade USP purity methylene blue is available in every emergency room in the United States, but its use does not currently extend to neuroprotection or cognitive enhancement. Low dose methylene blue currently has many human applications, including treatment of various metabolic poisonings, such as methemoglobinemia, cyanide poisoning, and toxic encephalopathy. Think about that. In a similar way as methylene blue is compensated for chronic cytochrome oxidase inhibition from poisons, methylene blue may also improve memory retention in conditions characterized by impaired oxidative energy metabolism. We're going to get into that. So methylene blue plus photobiomodulation is more energy and more neuroprotection. So unhealthy mitochondria, they produce a lot of harmful free radicals and produce very little energy. These guys need to be killed off. But if a healthy mitochondria is puffy, it produces lots of energy with very few harmful radical results. So when you look at a mitochondria, we're looking right here at this inner and outer wall, right here. We see this oxygen consumption. And if you create too much inflammation and pro-inflammatory cytokines and the cytokine storm that we all heard about, what happens is you're going to create high oxidative stress, and that gives you some neurodegeneration. Let me explain to you how that works. The H is hydrogen is pushed across on this level, and that's really the first thing that we're looking at. Okay, so here we go. Pushed here, and then this part here pushes some more hydrogen, and then this part here pushes more hydrogen, and then the cytochrome oxidase, the number 5, pushes it back down, and you make more energy. Okay? And that's really what happens. This is neuroinflammation. When you're not cycling these things across, creates too much reactive oxidative species, and down you go. So a little bit of that means less ATP energy. So the therapeutic benefits of methylene blue on cognitive impairment during chronic cerebral hypoperfusion. Hypoperfusion. This is a rat model. When they used an animal model of chronic cerebral hypoperfusion, they squeezed off both of the carotid arteries so that the blood didn't get to the brain. Poor perfusion decreases oxygen supply and results in hypoperfusion. And they cut both these off. And what happened was it's a risk factor for cognitive impairment and Alzheimer's disease, and affects mitochondrial respiration and memory consolidation. Therefore, drugs that improve mitochondrial function may be appropriate cognitive treatment for cerebral hypoperfusion. Methylene blue crosses the blood-brain barrier, and at low doses serves as an electron cycler in the mitochondrial transport chain, which I just explained. Previous studies implicate methylene blue in both memory enhancement and neuroprotection. We treated rats that underwent bilateral carotid occlusions and sham surgery, and then we gave them daily 4 milligrams of methylene blue per kilogram or saline. They looked at them and all their stuff, and they find out how they did. Daily methylene blue reduced the deficits in visual learning and memory that resulted from cerebral vascular insufficiency. While the hypoperfusion animal took longer to learn each problem, showed lower performance in challenging memory probes, animals that received daily doses of methylene blue performed significantly better than the saline-treated subjects, both during training and during the memory probe. This is the first study to demonstrate that methylene blue reduced learning and memory deficits caused by carotid occlusion. The results suggest that methylene blue may be beneficial for conditions involving chronic cerebral hypoperfusion, such as obstructive sleep apnea, tachycardia type of postural tachycardia, POTS, and mild cognitive impairment, vascular dementia, and Alzheimer's disease. Is an auto-oxidizable compound with unique redox mechanisms that are ideal for targeting neural tissue oxidative metabolism. After administration, methylene blue passes through the blood-brain barrier and accumulates in the human brain within hours. Methylene blue is a relatively small lipophilic compound, so it diffuses readily into the neuronal mitochondria. And at low doses, methylene blue enhances electron flow in the mitochondrial respiratory chain, therefore stimulates mitochondrial cytochrome oxidase metabolism and oxygen consumption, makes more neuronal energy. Methylene blue could even replace oxygen as an oxidant in anoxic conditions. Moreover, low doses of methylene blue display potent antioxidant effects. For example, low-dose methylene blue prevents superoxide free radical formation during reperfusion after ischemia. We've also shown that it decreases free radical-induced lipidosis. We have used low-dose methylene blue successfully in vivo as an artificial electron donor, donating electrons to the mitochondrial electron transport chain in its reduced form, and thus increasing cytochrome oxidase activity and brain oxygen consumption. Because methylene blue is proven effective in enhancing memory in a large number of experimental paradigms, including humans, we hypothesized that methylene blue could also effectively attenuate memory deficit in a memory loss model of cerebral hypoperfusion. Therefore, our objective was to investigate whether chronic administration of methylene blue could be used to improve learning and memory deficits caused by chronic cerebral hyperperfusion. 4 milligrams per kilogram of methylene blue was selected based on our findings of memory retention in various tasks. The doses above and below this range are less effective. Beneficial effects of chronic low-dose methylene blue on cognitive deficits caused by cerebral hyperperfusion presents a proof of principle and the basis for the possible development of early effective interventions against mild cognitive impairment and Alzheimer's disease. This also should have translational value for other memory disorders and contribute to the study of new neurometabolic mechanisms to enhance memory. Wonderful study. Despite compelling evidence of the role of chronic brain hyperperfusion and pathophysiology of mild cognitive impairment and Alzheimer's disease, animal models that exhibit this metabolic deficit have not been used before to test the memory-enhancing interventions targeting mitochondrial respiration. The present study is the first one to demonstrate that low-dose methylene blue has beneficial therapeutic effects on an animal model of chronic brain hypoperfusion. The study serves as a proof of concept to test the efficacy of chronic metabolic intervention with low-dose methylene blue in a hypoperfusion model relevant to mild cognitive impairment and Alzheimer's disease. Thus, if this intervention is proven effective in future clinical trials, chronic low-dose methylene blue treatment could be accomplished with relatively inexpensive and non-invasive means. Adverse reactions of methylene blue have only been observed with doses much larger than our range of interest, and with non-pharmaceutical chemical grade methylene blue that contains toxic impurities not found in the USP methylene blue. Methylene's ability to target cytochrome oxidase and neural energy metabolism at the mitochondrial level provides us with a novel approach to attenuate learning and memory deficits. The effects of transcranial photobiomodulation and methylene blue on biochemical and behavioral profiles in a mice stress model. This is with my co-author, 2020, Fazad Salahpour. Photobiomodulation, methylene blue, what happens? Effectiveness of transcranial photobiomodulation and methylene blue in the treatment of learning and memory impairments is previously reported. In this study, we investigate the effects of transcranial photobiomodulation in combination with methylene blue alone or on unpredictable chronic mild stress induced learning and memory impairment in mice. So if you stress out the mice, they don't really do so well, but if you give them photobiomodulation and or methylene blue, the behavioral test revealed that the unpredictable chronic mild stress, impaired learning and memory, and the treatment with methylene blue and photobiomodulation and their combination reversed these impairments. A significant improvement was observed in the treatment group due to the reversion of the aforementioned molecular analysis caused by this unpredictable chronic mild stress when it was compared to control levels. Both PPBM and methylene blue in combination or alone have significant therapeutic effects on learning and memory impairment in the unpredictable chronic mild stress mouse. See that? Better than normal, better than control. All right, they just respond better. Methylene blue and photobiomodulation recover cognitive impairment in hepatic encephalopathy through different effects on cytochrome C oxidase. Here we are looking at this coming around the corner here. So Hepatic encephalopathy is a brain disorder caused by liver dysfunction. Think about that. Your body has effects on the brain. It occurs when the liver is unable to properly filter toxins from the blood, leading to a buildup of these substances, particularly ammonia, which can then travel to the brain and affect its function. This condition can result in a wide range of neuropsychiatric symptoms, from mild confusion to personality changes to severe impairment of consciousness, even coma. Think about this. Removing toxins from the brain. And if they build up, it creates cognitive impairment like brain fog. Neuroinflammation is now recognized as a key player in the development of and progression of hepatic encephalopathy. And so here's how it works. Again, the methylene blue here in yellow is pushing these anions, these protons across the way, more hydrogen on the one side, and then photobiomodulation hits the CCO and drives more ATP into the system. So two different hits, bang and bang, both helping mitochondrial function. Okay? And this study identifies the neuroprotective and functional improvements effects of methylene blue and photobiomodulation on hepatic encephalopathy-induced cognitive dysfunction. We demonstrate that although both treatments could effectively improve the learning deficits, there's a differential effect on CCO brain activity. Okay? Our findings could be supported previous findings showing that PBM upregulation of CCO, but not other mitochondrial complexes, is not as effective as methylene blue in hepatic encephalopathy, whereas methylene blue is able to bypass the encephalopathic mitochondrial damage to complex 1 and 3, sending electrons directly to the CCO, which increases its activity, more mitochondrial energy. Taken together, information for our study indicates that improving brain CCO activity may prevent neurologic deficits from toxic encephalopathy. Again, Gonzalez-Lima, back in 2015, protection against neurodegeneration with low-dose methylene blue and near-infrared light. These are neuroprotective again. Methylene blue pushes that hydrogen ions out of the inside of the mitochondrial membrane, and then the infrared light pushes it back through this pump of the complex 4 via photon absorption, and you get more ATP, more energy. Okay, boom, two mechanisms, right? And we just described two very different chemical physical interventions resulting in similar cellular mechanisms targeting mitochondrial respiration. One entails fostering electron cycling by an auto-oxidizing redox chemical, and the other using photoabsorption from near-infrared light. New and in vivo evidence from animal models and human studies suggests that low-dose methylene blue and low-level near-infrared light share a common mechanism of enhancement of mitochondrial respiration that protects against neurodegeneration in a broad range of animal models and human neurobehavioral disorders. We hope that this fascinating neuroprotective approach targeting mitochondrial respiration will stimulate more human studies and potential therapeutic applications in neurology and psychiatry. Why not? Here's a paper from 2021, treatment of Klein-Levin syndrome with intranasal photobiomodulation and methylene blue. Yes, guess what? We have both of those. Let's use them, right? Klein-Levin syndrome is a rare neuropsychiatric disorder characterized by recurrent episodes of idiopathic hypersomnia, sleep too much, cognitive and behavioral abnormalities such as memory loss and childlike language. There is no definite etiology as to why this happens. However, there are hypotheses of genetic predisposition, autoimmune mechanisms, abnormal thalamic and hypothalamic functioning. Similarly, there is no definitive treatment for KLS, as one method may be beneficial for one patient and not for the other. We present a case of KLS in a patient who has no clinical improvement in symptoms from a variety of treatments. The parents of the patient agreed to attempt a trial of intranasal powered remission of the KLS episode following treatment, with no further KLS episodes reported after treatment of photobiomodulation with red light in combination with methylene blue. Pretty amazing. Let's look at here. An 18-year-old patient with flu-like symptoms, which triggered a prolonged episode of longer than typical duration, extending close to 6 months. They wanted to try an off-label use of intranasal photobiomodulation with red light, and we have red and infrared, nightly for 25 minutes in conjunction with methylene blue, 10 milligrams orally, 1 hour prior to the use of intranasal photobiomodulation. That's what we're saying. Take the methylene blue at night, about an hour before bed. Then do your light and watch what this thing can do to your brain. It's already going to be lodged in the brain, and then you hit it with light, zoom. Within 1 week of treatment, the patient began to normalize with the remission of his hypersomnia, too much sleep, and his cognitive and behavioral abnormalities. After 1 month, the patient and family members noted that the lack of recurrence of all these episodes, as well as the return to socialization with friends and family. 6 months after starting intranasal photobiomodulation plus methylene blue, the patient enrolled in college. At 20 years old, 2 years after the treatment, the patient has not experienced a relapse of an episode and has been taking any other medications nor reported any other side effects. Okay? Common sense, commonly seen in prior studies have shown that methylene blue crosses the blood-brain barrier, preserving its integrity, increasing circulation via inhibition of nitric oxide synthase, and decreasing lipid peroxidation and inflammation, ROS. The idea that enhancing cognition with methylene blue is not far off. As discussed, methylene blue can improve mitochondrial function and decrease oxidative stress, which can improve the neuron's effective functioning, therefore basal neurophysiology and improve cognitive tasks, more energy. Human fMRI studies have shown that low-dose methylene blue administration led to an increase in activity in the bilateral insular cortex during attention and memory tasks, as well as enhancing memory retrieval. Using methylene blue and photobiomodulation in conjunction may promote a greater benefit than using one method over or the other. As discussed, both can upregulate cellular respiration in the mitochondria with the benefits of neuroprotection from degradation. Methylene blue accomplishes increased cytochrome oxidase expression through supporting the electron transport chain, and PBM directly energizes the oxidase through photon absorption. However, it's important to consider the hermetic dose, so high dose is going to have the opposite effect. We don't want to do that. PBM has a similar relationship. At lower doses, low energy induces increased membrane activity. But if you go too high, we don't have to worry about that. It can get lower. Again, the hormetic dose. Too much is not going to be beneficial. And this is how we can dose it. 1 to 2 times. Once in the morning, do your lights. Once at night, do your lights. It should stay there for 4 to 6 hours, right? If the color is a dosing and safety, 4 to 6 hours, maybe longer. So this is very reasonable. 1 tablet twice a day or 2 different tablets going to have a very beneficial effect. A novel approach of combining methylene blue, photodynamic inactivation, photobiomodulation, and oral ingested methylene blue in COVID management, a pilot study with a 12-month follow-up. Transcranial photobiomodulation and methylene blue. Okay. Coronavirus caused by SARS-CoV-2 virus was first recognized in 2019 and remains a significant threat. We therefore assess the use of local methylene blue photodynamic viral inactivation in an oral and nasal cavities in combination with systemic antiviral, anti-inflammatory, and antioxidant actions of orally ingested methylene blue and photobiomodulation. The proposed protocol leverages separate combines methylene blue and red light diodes to comprehensively address the pathophysiology sequelae of COVID-19. A total of 8 pilot subjects with COVID-19 disease were treated in the Bahamas over the period of just a couple months using a remote care program that was developed for this purpose. Although not a prerequisite, none of the subjects received any vaccines, and clinical outset tools was a series of threshold measurements and online questionnaires and 1-year follow-up. So let's take a look where they treated it. Let's curious. So what they found was rapid reduction in the viral load was observed, and the negative PCRs were documented within a median of 4 days. These laboratory findings occurred in parallel with significant clinical improvement, mostly within 12 to 24 hours of commencing the treatment protocol. There were no significant adverse effects, and none of the subjects who completed the protocol required patient hospitalization. The outcomes were similarly encouraged 1-year follow-up with virtual absence of long COVID symptoms and or COVID-19 reinfection. Our results indicate that the protocols may be safe and promising approach to challenging COVID-19 disease. Therefore, due to the broad spectrum of activity, this approach has the potential to address prevailing and future COVID variants. Extensive studies are warranted. So this is all they did. They just used a little bitty device right here in the mouth with only red. We can put it in the nose. We can put it in the head. We can do everything. How about this one? 2020, mitochondria as a target for neuroprotection, the role of methylene blue and photobiomodulation. In humans, mitochondrial dysfunction plays a central role in the formation of neuroinflammation and oxidative stress, which are important factors contributing to the development of brain diseases and brain fog. Ample evidence suggests mitochondria are a promising target for neuroprotection, and recently methods targeting mitochondria have been considered as a potential approach for treatment of brain diseases through the inhibition of neuroinflammation and oxidative injury. This review will discuss 2 widely studied approaches for the improvement of brain mitochondrial respiration, methylene blue and transcranial photobiomodulation. Methylene blue is a widely studied drug with the potential effects in animal models of brain disease, as well as some human studies. Similarly, PBM is a non-invasive treatment that promotes energy production and reduces both oxidative stress and neuroinflammation, and has garnered increasing attention in recent years. Now, as we stated, methylene blue and photobiomodulation have similar beneficial effects in mitochondrial function, oxidative damage, inflammation, and subsequent behavioral symptoms. However, the mechanisms underlying the energy exchange, enhancement, antioxidant, and anti-inflammatory effects differ. This review focuses on mitochondrial dysfunction in several different brain diseases and the pathological improvements following this treatment. So this kind of just is the overview. Low concentrations of methylene blue exert antioxidant and electron shuttling activity that supports respiratory chain function. Just like we said, more cross, boom, and then that's how that one works. Okay. So recently, according to randomized double-blinded controlled trials, low doses methylene blue was able to increase functional MRI activity during short-term memory tasks and also improve memory retrieval. So it's very good. It crosses the blood-brain barrier. So look at this. In a clinical study, patients with mild to moderate Alzheimer's disease took methylene blue at 60 milligrams 3 times a day for 24 months. Results showed that patients with methylene blue showed an 81% reduction in the rate of cognitive decline after 50 weeks. That's a high dose, but it worked. Methylene blue patients linked to the prevention of tau aggregation has been suggested to directly interact with the mitochondria as a catalyst, carrying electrons away to the complex. During the conversion between methylene blue and its reduced counterpart, excessive ROS is reduced by bypassing the pathological blockages. So when photobiomodulation stimulates the complex 4 activity in normal cells, mitochondrial membrane potential is increased above normal baseline levels, resulting in brief and rather modest increases in ROS production. The short burst is able to activate cytoprotective signaling, which attenuates ROS-induced oxidative damage and neuroinflammation. Just a wonderful system. How it works together. Boom, boom, boom. How does it work? Summary of effects of methylene blue and or photobiomodulation and neurodegenerative disorders. This is it right here. It increases functional memory retrieval, decreases tau binding. It does the same. Decreases edema, increases autophagy. Then this is what photobiomodulation does. They work hand in hand. You can do one in depression, in stroke, and Parkinson's disease, and TBI. It stimulates mitochondrial cytochrome oxidase metabolism and oxygen consumption. Low-dose methylene blue prevents free radical formation, reduces oxidative stress. It's a potent antioxidant, antimicrobial for the gut, increases brain oxygen consumption, improves memory, significant therapeutic effects on learning and memory impairment, Methylene blue and photobiomodulation have similar beneficial effects on mitochondrial function, oxidative damage, and neuroinflammation, subsequent behavioral problems. So I hope this was an extensive overview, but the bottom line is take it at night, do your photobiomodulation, take it in the morning, do your photobiomodulation, and check your dose to see how much you really need to take to get these great benefits. Thanks for hanging around. I had a great time preparing this for you.